I inject once it's down. I keep the needle still. And I'm injecting right now. What we're about to do right now is I decided to come on my phone and record this video because I haven't done a lifestyle management update in a while. So I was like, yes, change the scenery, and because I do my injections here in my living room, and here we are. So I'm like, y'all love the Bratz tracksuit. I love this tracksuit, but I must admit, if y'all haven't seen my latest haul on Ed Hardy, those tracksuits fit and shape my body like no other tracksuit ever. Well, I have a, how do you say it? Givenchy, there we go. Givenchy tracksuit, and it fits amazing. But the Ed Hardy tracksuits, they just really, to me, like this one looks better when you wear it high. I don't know, just give me that vibe of like high vibe. And these pants, it make my booty look like a upside down heart shape, which is, I guess. But anywho, these are super cute. Like I love the bezazzled on the butt and the bezazzled B. It's like so bratified, and this it's like bezazzled. It's so cute. So, and it's brown and it's cute, and I added to my collection. I actually got this from eBay because they were sold out of my size. I think it was sold out this whole set, to be honest, on Dowkill. So I was like, what? Let me get this. Because I was looking at the other ones. It was like my favorite one. So I got this for a good deal. It was like new. I can't tell it was ever worn. It actually had like the little plastic tie still in the pants. So whoever wear it didn't wash it a lot, or they didn't wear it a lot for that to fall out. So but okay, this video isn't about that. I just went on a whole rant about my tracksuit. But in today's video, we're going to go over my what are we going over? My lifestyle management. So it's going to be my semaglutide and my MIC. Now, if y'all haven't seen my other video, go check that video out. I'll probably put a suggested video at the end. So watch the video to the end, and it'll have like suggested videos, and it'll have like the semaglutide or MIC lifestyle management. But that's what it's called. You can look in my playlist. In today's video, I'm going to talk about, I'm at 160 right now, but I've been, what they call it, like yo-yoing my weight right now at like 160 to 163. My food cravings are like back where, to the point where I'm like, I want to go eat something. And like, it wasn't like that when I first started it. So this last month, I feel like month or two has really been like, really like clawing at me. Like, it's time for me to go up in dose. I've been microdosing like extremely on semaglutide, like the lowest amount. So I'm actually gonna go up. It says I can go up to 20, but I don't want to go up the full 20 units because I'm at 10 units. So I'm gonna go 10.7 units. I feel comfortable. I feel like it's more than half of a unit. And then it leaves me room, 7, 8, 9, 10. It leaves me like 3 points to go up again if I want to like take it to the extra mile. I don't want to go to 20 and not feel well on 20, so I don't want to risk that. And I want to still have that cushion for me to go up to 20 or half, or 20 and a half or something for units, to like slow my dose, because I might not need all that. And by the way, I pay out of pocket for this, so the less I use, the more it lasts, and more I get for my buck. So I want to see how my body do with it. This is the product I use. I'm not going to gatekeep. This company is not sponsoring me, but I'm going to shout them out due to the girls who are interested in using a reliable brand. This is but always recite with your doctor of which brand is best for you, even though I know certain doctors doesn't know, but this is the compound drug of semaglutide. If you go to what is it called? A maintenance, a med spa. Med spas have these, and so on and so forth. So I administer myself, but I got a prescription from my doctor to administer myself because I was going to a med spa, but actually I was going to an urgent care getting mine done. They had a nice program there, and I did some research, and this brand Olympia is a reliable source for compound semaglutide. In this video, I'm going to talk about my weight, what my goal weight is, and all of that. So my current weight is 160, like I've said. I fluctuate between 160 and 163. My goal weight is 130. But now that, like, you know, my breast is filling out, my hips are getting a little wider, like, as you can see, this is like really like fitting, and you can see like my hip right here is obviously poking out right there on the side. So yeah, even when you see me about to sit down, all that, you know, has really been filling out. I can feel it jiggle. So, and I want to keep that, you know, in my butt. I don't want to lose too much of it. So I'm like, is 130 like listic is listic for me? I like that. That's like my new word, listic. Is it listic to me? Like, is it listic? Because it's like, you know, like realistic, but listic. Because forget the real, just put listic in it. Is it listic for me due to the fact of how I really want my body to be? And I like a little thickness, but I do want to lose my arms more. They has went down quite a bit. I am happy with my results. It's just time for me to make this change. My grandma was like, go to Tony, go to Tony, go to Tony. She's on it as well. She's not on this one specifically, but she is on a weight management drug that work with the hormone GLP-1. Okay, so I'm going to, I'm going to do my MIC as well. I'm not going up in dose on my MIC because, yeah, this stuff goes by so fast. Okay, let me get this together. I'm just going to like have y'all on here, me ministering myself because, yeah, so if y'all sensitive to that, be sensitive to it. I thought this would be interesting. There's like no like people doing this at home. If there is, they're like really like, I don't know. It's just, I want to do it. Okay, so this is my needle for my MIC. Law, like, what is MIC? What is MIC? Check out my old video. But MIC is basically, law, like my medicine keeper. This was featured in a video when I did an organization. It's actually the Little Mermaid hardcover where my makeup came in. Give me 1 second. Let me get my other needle. Yeah, I feel like my doctor like wrote up their own. I don't know. It's strange. It's like they wrote up that I should be taking 0.5 mg, but then they put 20 units. But on paper, that equals 20 units, not 10 units. But I've been doing 10 units, so I've been doing under. But they did say that was the starting dose they was giving me. I think they just meant to put a 2 in front of 5 in that, like 0.25 mg for the unit to be 10 units, which I've been taking. I don't know. I'm not going to question it too much because I did all my numbers and I did my math that I'm doing the right thing. But back to what I was saying about the MIC. MIC is basically a B12. It's like a vitamin complex that is also, this is also known as like lipo injections. Far as when I did my research, basically what it does is it gives you lots of energy. It also, if you're vegan like myself, it helps with that because vegans typically have a lower B12, but a lot of people have low B12. Like for me, I don't know, it's like a thing for me. I've been having low B12 for a long time, but given the fact that I am vegan as well, so I don't eat that stuff. But it gives you that and it helps burn energy, fat per se. And yeah, it's an overall healthy injection for a lifestyle management, okay? So it keeps you lean, mean machine, okay? And that's the B12, but you have to be consistent with it. And I just got it reordered. So I'm noticing I love this stuff. So I'm gonna, every time I get low, I'm gonna reorder it. Now this is the semi-glutide. A little bit left really well, and I get my blood work done. When you're on these medications, you have to see your primary doctor, getting a blood panel, checking your pancreas, your liver, your kidney functions, your blood levels, all of that to make sure your body is working as it should. Okay, so I'm going to do the MIC first because I have to inject it muscularly. So I'm going to inject it in my muscle. So give me 1 second. Okay, so I've had to put something in front of me because I don't have no underwear basically on. So you may not be able to see this, but you'll see me at least fill up the needle itself. So I'm gonna get the needle ready and get ready to inject myself. I like to do the MIC first because it's the worst one because it got to go into your muscle, meaning the needle is longer. And you'll see my reaction. So I like to screw it, make sure it's on all the way. Then I like to fill it up to where I'm going to inject myself. I do 1 milliliter, which is what is prescribed for me. I inject it, and I do this once a week, every Saturday. And then I flip it upside down. I like to bring it out a little bit. And then just draw the medication up. I usually go past 1 because it always have air in it. And then I push like so. And then I pull back to 1. And I like to make sure it's nice and even, like so. And then I tap it. So that's how much I inject. I must admit, it's quite a bit of fluid. I do go through this one the fastest due to how much liquid is going into me. But like I say, it's a B12, basically a B12 shot. Yeah, so I'm gonna put the top back on this for now while just enough where I can sit it down. Then I'm just going to, I like to measure, my grandma told me, so your hand, so from your knee to like the end of your hand, that's like the injection area you want to go. Okay, so like knee, so up in here is where I like to inject. Or a little bit lower, you know. Yeah, my hand's not that big, so yeah. Okay. All right, and then I like to massage the area a little bit. And I've learned to evaluate the area, make sure you don't see no visible veins, because I've done it before and I bleed more if I'm not like mindful of where I'm injecting. And I kind of go on the side, but like kind of like side top. So not too much on the side and not too much like in the center of your leg. I think some people inject really fast, but I've learned to not do that. First off, that's not my thing. I like to, and then I like to make sure I got the muscle like in my hand. So I like to stretch my leg out and stuff like that. Ooh, my legs are shiny, beautiful. Okay, and then I like to get this one over with. So, okay, let me focus. I make sure it's lined up, like the 2 things on the side, like this part is right here so I can press down and have a good grip. So find the area, make sure I'm in a muscle, okay? And then make sure I'm not by a vein, and I'm going to go. I do moan. Mm, 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 mm. I go really slow. I'm still inserting. I'm still inserting. And then I inject once it's down. I keep the needle still. And I'm injecting right now. Ah, 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 ah. And then I yank really fast up, straight up, and make sure your form is like straight up. So when you injecting it, see all of this in. And when you injecting it, you want to be mindful. If you're going to go straight up, you got to remember to go straight down. You don't want to be on the side. You don't want to be lace way. You want to be kind of like right where you at. So pinch, insert it down. Make sure you're not the vein. I did see a vein and the vein was like right here. I went like on the side right there. Boom. And I'm not even bleeding. That was a beautiful insert. So I make sure the needle was all the way in before I even start pressing it down. Once it was all the way down, I then began to make sure my hands was placed on it, and then I started to press, slowly press. And once it was done, I stopped, and then I took a breath in and yank right up. And that was a beautiful job. I'm not even bleeding. Want to see? So that's where I went, and you can't even, right up in here. There's nothing. Nothing. Okay. So that was that. Okay, so now we're done with the mic. I put this in here, and y'all want to see what it looked like? It's by the same company, but yeah, this is the mic. Okay, there you go. Does it give me a lot of energy? I think it's when it's time for me to use my energy, it's there for me to use. Do I always use my energy? That's all I'm saying. But I am on that, and I'm also on estrogen, so yeah, I don't even know where I went, so I'm just gonna go over the whole entire leg with some alcohol in that area, and I kind of press down, like massage the area as I'm rubbing it with the alcohol to kind of like massage that product into my body so it can absorb very well. And I am done with that. So let me go ahead and pull my pant up. Okay. All right, so now we're gonna do the semaglutide. Now this is new for me, you all. This is new. By the way, excuse the cough. I just got over a fever. I had a fever, and I was going through a cleanse, I guess you can call it. So, yeah, I have a little slight cough, and my voice is still not 100% like it is, but I can tell my voice is getting better. I notice I can get better in those lower pitches than earlier. Earlier, I was like sound like Miss Pig or something. Do Miss Pig have a deep voice? I don't know. And then I have a bucket, the Renaissance bucket right here. Let me show you all. I think this would be interesting to show you. Okay, it won't turn. So this is the Renaissance. See, I'm like embodying Renaissance. And then all of my needles. Oh my goodness. Y'all see that? Yeah. You're supposed to have a lid on it, but I live alone, so there's no one that's going to be digging in my Renaissance bin. So when I'm ready to dispose of them, I can like dispose of them into a proper bin or something with a lid on it. Okay, so we did my mech. Now we're going to do semaglutide. Did I clean it? See, I don't remember. So I'm just going to clean it again. You can't, look how little the baby needle was. And then I stick this in my upper stomach. Yeah, right here. I've been noticing like my stomach has been going down, like it's been less and less fat tissue I can grab. Did I do it on this side last time, or I did it on this side last time because I remember that it hurt it last time. So I'm gonna do it on this side, and I'm gonna do it a little lower because I don't want it to hurt. So we just cleaned that. So now I'm going to draw this up. Remember, this is a new, I pulled both of them off, the top on the bottom and the top on the top. I'm going to sit them right here for now, before I can put the needle top back on when I'm done. I'm going to draw up where I'm going to do my medication. I'm going to do 10.7 units. So 5, 6. Okay. And then I'm going to insert it. So that's how much I'm doing. Before, I used to just do 10. See 10 right here? So I'm doing that much more, which is not that much more. 20 would have been right here. See, that's quite a bit more. So I'm doing like halfway between 20 and 10, but then I'm doing one. It's basically like one notch because it's sitting right there on the second notch of the halfway mark. Okay, so then I'm going to insert it, push that air in for it can draw up nice and easy. See, I still have quite a bit of fluid left. Yeah. So I'm going to draw it in, push it back in, get rid of that air, and then go to 10 point right there. These lines are so little, so you gotta really look. I feel good with that. All right, so that's, and I hit it. Still a little bit of product. Let me see. Still quite a bit of product left. So I'm gonna go ahead and insert this now. Oh, I need to put this back on. Ooh, see, I had it the wrong way. And sit it down and then clean the area with some alcohol beads where I'm gonna inject. So what is semaglutide? Check my other video out for more information. But basically what semaglutide does, it changes the way your body, okay, so I'm like an inch up from my belly button on the side. It changes the way your body delivers insulin, and insulin is what turns into fat to store. It also turns your fat from white fat to brown fat. Brown fat is the fat that burns the quickest and the fastest. It burns when you're sleeping, it burns faster when you're doing activities, and so on and so forth. It also shuts up food cravings. So it does all of that benefits into for weight loss. All right, here I go. And we're done. So I'll check back in with you all and let you know how the new dose went, given that I'm like 7 lines at it. So like you see these little bitty, let me move out the way, these little lines in between, I did like 7 extra lines, which is not quite a full 10 units. It's basically 7 units I did extra. So you can say I did 17 units opposed to 10 opposed to an extra. Wait, no, that's not 17. Yeah, I did an extra 7 units opposed to an extra 10 units, leaving me 3 units to play with if I want to take time to go up. See how my body reacts to that. See if it shuts up my food cravings. Put this in the bin. And I'll let you all know. I felt like it was time to go up. If I don't feel any changes this week, I will go all the way up to the 20 units. Not even playing. Okay, so I got this mixed up. So this actually goes in here, and then this goes in here. Okay. So if I don't feel any changes, I'm about to drink lots of water because I just took medication. I like to make sure I drink water after I do medication. And yeah. What else? What else I wanted to talk to you about? My laser hair removal, if y'all haven't been following, has really improved. I really don't need laser no more on the side of my face. Right here has really improved. This side right here, as you can see, still got a little spot right there. So around here still needs to get taken care of, and my chin, but my side of my face don't need it. Look how freaking clear my skin is. It's like all one tone, which I'm in love. By the way, I'm also using a glow cream. Look at that, no makeup. That's for my glasses. Ugh. Yeah. I'll update you all with how that goes. That's my check-in with my weight. Yeah, so I said like my weight 130. So what is your weight now? What's your goal weight now? Intrinsic, what's your goal weight now? I think it's still 130. I'm not even gonna hold you. But I think I'll see what I look like at 140 if I'm still saying that. You know, because I'm also growing my boobs because I'm on estrogen. So who knows? That might be an extra 5 pounds. So, you know, and then hips are growing 10 pounds right there. So I'm like at 10 pounds, 12 pounds. So that already puts me in like 140 range, you know, 145. So I may not even want to lose anymore after I hit 140, you know? So that's only 20 pounds to go. If I put it in that perspective, if I put 30, that's 30 pounds to go. I don't know. We'll see. Because I do want to be a petite girl. Like I want to be very petite, snatched. That's just the look I prefer. Lean, mean. So I don't know. You'll see how my body reacts and what it does. Right now, I know I'm still not where I want to be. I know that. I know at least I need to be 15 pounds lighter. Right now, I know 15 pounds for sure. That put me at like 150. No, that's lower than 150 because I'm already 160. That put me at like 145. Okay. So an extra 15 pounds. See what I look like then. I know 15 pounds for sure. I sound like one of them girls. I just want to lose 3 pounds. I want to lose 15 pounds. Like, well, that's my tea. That's my business. Who cares? That's my thing. Oh my goodness. Oh my goodness. Oh my goodness. I'm happy I was able to do this video. I think it's interesting for the girlies who was interested in this. By the way, I did lose 30 pounds already from when I started this. So I am very happy. Yes, I have fangs. I'm like in love with my tea. My dentist did such a great job. Okay. Where was I? Where was I? My nephew was like, do you have fangs? I was like, you didn't supposed to say that. I want to go see that new vampire movie too, by the way. I think it's called like Count Van Pleur, or something like that. It's like it looked like it's shot very well, and I just love stories of vampirism, so I really want to go check that out. I recommend anyone who wants to feel like they're top notch, get yourself a great lash tech, a lash specialist, and let her hook up your lashes for you. Not no lashes at a nail salon. I mean a specific lash tech who work with individual lashes. Who work with lash extensions to grow and take care of your lashes. Because I get my lashes done once a month, and yes, it costs hundreds of dollars, but it's a great investment onto yourself. Okay, I'm gonna leave. I'll see you on the next video. I'm about to go drink my water right now. Yeah, 1 liter.